Health Organization and the Commonwealth Secretariat. We have our leaders here, Dr. Tedros Ghebreyesus, Director General of WHO, and Right Honorable Patricia Scotland, the Secretary General of the Commonwealth Secretariat. In addition, we are joined by the High Commissioners of the Commonwealth countries in London, ambassadors of Commonwealth countries here in Geneva, as well as WHO representative in Commonwealth countries around the world. Thank you very much for joining us, to all of you. We would like to start this meeting by showing you a joint video which actually illustrates health challenges in the Commonwealth countries and the commitments that we are undertaking here today to address them. Please, can you put on the video? Thank you.
The world faces unique health challenges as COVID-19 still poses unprecedented threats to health systems, economics, and societies worldwide. There is no better time than now to come together in global solidarity. The Commonwealth brings together 54 countries and is home to more than 2.5 billion people. No matter their size, income level, or location, all Commonwealth countries have suffered from the impact of the pandemic. The World Health Organization and the Commonwealth Secretariat are joining forces to leverage their unique strengths and expand their collaboration in 7 priority areas, including the achievement of universal health coverage, strengthening global health security, and building a data partnership. We will work together to improve health outcomes across the entire Commonwealth and scale up support to small states that are particularly vulnerable to the health and environmental impacts of climate change. Our shared objective is to place equity at the heart of all global health efforts, end the COVID-19 pandemic, and help the world get the 2030 agenda back on track. Now is the time. Let us come together to address the greatest global health challenges of the 21st century and emerge stronger with robust health systems and more resilient societies worldwide.
Dr. Tedros, we would now like to invite you to present your introductory remarks.
Thank you, Ivana. Your Excellency, Patricia Scotland, my dear sister, Excellencies, dear colleagues and friends, the devastating consequences of the COVID-19 pandemic go far beyond the disease itself. It has deepened economic, social, and health inequalities around the globe, in countries of all sizes and income status. The impact of the pandemic will be felt for decades, especially among the most vulnerable groups. The longer the pandemic drags on, the worse those impacts will be. That's why it's critical that nations work together even more closely to support all countries to vaccinate 70% of their populations by the middle of this year, strengthen the resilience of health systems, and work towards an inclusive economic recovery. At present, only 42% of the population of Commonwealth countries have received a full course of vaccination, and there is wide disparity between countries. African countries of the Commonwealth have achieved an average vaccination rate of just 23%. Bridging this gap is an urgent priority for WHO, not only for bringing the pandemic under control and saving lives, but also for protecting livelihoods and supporting a sustainable recovery. We can only bridge that gap by working together in partnership, which is true for so many of the challenges we face. I am a strong believer in partnerships. Over the past few years, WHO has institutionalized its collaboration with many regional groupings, platforms, and organizations with whom we share common goals and principles. The Commonwealth of Nations is one of our most unique partners, representing 54 countries and 2.5 billion people. The strength of the Commonwealth lies in its diversity and shared inheritance in language, culture, and the rule of law. WHO and the Commonwealth share the same values: to respect all states and people, to seek consensus through consultation, and to support the most vulnerable communities. We are both champions of small states, which are particularly vulnerable to the health and environmental impacts of climate change. I'm therefore delighted to sign this Memorandum of Understanding to elevate our partnership to the next level. Many Commonwealth countries have made unprecedented commitments in recent years to improve the health of their people. This includes fast-tracking the timeline to eliminate malaria, blinding trachoma, and cervical cancer, and expanding health insurance and access to services. WHO is committed to working with the Commonwealth Secretariat closer than ever to maintain momentum and to provide technical guidance to countries to help achieve these goals. We're setting 7 priorities under the MOU: promoting universal health coverage and primary health care, strengthening global health security, promoting healthy environments, improving the health of vulnerable groups, transforming lifelong learning, building a data partnership, and creating space for innovation and the exchange of knowledge. There are a number of existing initiatives that we will use as catalysts. These include WHO's initiative for small islands, developing states, the Universal Health and Preparedness Review, the WHO Academy, our global initiative on childhood cancer and breast cancer, and the Global Diabetes Compact, to name a few. Your Excellency, Secretary General Patricia Scotland, I appreciate your commitment to stronger collaboration with WHO, and I look forward to working closely with you and your team to pursue WHO's mission to promote health, keep the world safe, and serve the vulnerable. Thank you for your leadership, my dear sister. And thank you. And back to you, Ivana.
Thank you, Dr. Tedros. We would now like to invite the Right Honourable Patricia Scotland, Secretary General of the Commonwealth, to take the floor. The floor is yours.
WHO representatives in Commonwealth countries, colleagues and friends, thank you for being with us today. And Dr. Tedros, my dear brother, thank you. Thank you for your words. Thank you for your friendship to me and to the whole Commonwealth family. And thank you for your leadership now and throughout this terrible pandemic. You and the World Health Organization that you lead have done extraordinary work in unique and terrible circumstances, and we are all extremely grateful. Signing this Memorandum of Understanding is an important moment. The Commonwealth is a family of 54 nations, bound by history, tradition, and shared values. It is the home to more than 2.5 billion people, 60% of whom are under the age of 30. Our mixture of advanced economies, developing economies, and small states is spread right across the globe. We have huge advantages, real challenges, and limitless potential. Dr. Tedros, you have already said so much with which I agree and wish to reinforce. So I will focus my contribution today on 3 things. First, your call for nations to work together to vaccinate the world could not be more important. In this, the partnership we are sealing today has immediate and vital practical application. Equitable access to vaccines, especially for small and vulnerable countries, is the most pressing political, economic, social and moral priority. If we fail to deliver effective and prompt action on vaccines, we face perpetual global crisis that threatens all of our health, wealth, and security. So I fully endorse the WHO's goal to vaccinate 70% of the population of every country by the middle of this year. And I hope that this can be achieved across the Commonwealth before our heads of government come together in Kigali in June. It is self-evident that if this is to be achieved, we must concentrate our efforts on the least developed, the developing, and on small states. 32 of the world's 42 small states are in the Commonwealth. At current global vaccination rates, we could vaccinate the entire population of these states within 2 or 3 days. In doing so, we can protect the most vulnerable people in our world. We can reopen and re-energize economies from across Africa, the Pacific, and the Caribbean, and we can give the countries in the greatest need a foundation for sustainable development. If we can, we must. Second, the WHO and the Commonwealth have long shared a vision for what we can achieve together. Working together in a spirit of partnership, harnessing technology and data to help our member states in so many ways. Tackling the full range of disease from malaria to cancer, building strong, resilient, high-quality health services to which everybody has access. Rising to new challenges such as the health impacts of climate change. The partnership we are signing today turns that vision into a practical action plan for the long term. It can help us to do more for the people our organizations strive to serve. I am proud of that. Third, that this, what we are doing here today, matters. Partnership matters. Multilateralism matters. Progress is made when countries and international organizations come together and work together. Dr. Tedros, you recognize the Commonwealth's diversity, our shared inheritance in language, culture, and the rule of law, and the bonds of history and tradition. As leaders, it falls to us to ask ourselves what inheritance we wish to bequeath to those we serve and those who come next. My vision is for a safe, equitable, and just world where the needs of the most vulnerable are at the heart of what we do. I believe this partnership is a step towards that. And I'm confident that by formalizing and deepening our work at every level, we can better serve the 2.5 billion people of the Commonwealth and provide an example to the rest of the world. And I thank you from the bottom of my heart for everything you have done to make our world a safer, better, healthier place. And on behalf of all those who have not thanked you, and on the days when you will think that people aren't seeing, can I just say to you, we see you, we celebrate you, we salute you, and we thank God for you. So thank you.
Thank you very much, Director General and Secretary General, for your inspiring words. Now, we would like to invite you to sign the Memorandum of Understanding and launch this partnership for the years to come.